Hello, welcome everyone to Do With, Making the Movement Happen. My name is Adam Lent and I work at the King's Fund, which is one of the organisations that backed the original Do With call to action, which was launched back in January. The purpose of this meeting is really to get a movement off the ground. So it's a little bit different, maybe, to other events that you have attended, where maybe you learn a lot, you listen a lot, you talk a lot. The purpose of this meeting is really about action. And it's really about trying to create that grassroots momentum for change. And the fact that we already have 500 people on the call and more people are joining as I speak, I think just highlights the frustration really that exists in the system towards a system that really does keeps doing to people rather than doing with them. When all of us know that a do with approach is not only more humane and more democratic, but is also actually the only way to deliver a sustainable system. So it feels like the time is right for this effort to try and launch this movement. It feels that we need that radical change. And with the Chancellor likely to announce even deeper cuts later this afternoon, it feels like this movement is as urgent as ever. Now, you might be feeling a little bit isolated at the moment. That's because so many people have signed up to the movement, to this event, that we have had to use a platform called Teams Town Hall. Now, Teams Town Hall is great for getting loads of people on a call, but it's not great for interaction and networking. But when we move to the breakout sessions, which will happen around about 10:45, then you will have a chance to network, talk, interact far more. And I'll say a little bit more about the breakouts when we get to that point later in the event. Anyway, before we get to that stage, we are going to have a panel discussion. And we have a panel of absolute, what I would call do with heroes. These are people that have been driving do with change, writing about campaigning for do with change for many years. And we're going to be talking to them about the nature of do with change, why we need that change, and most importantly, how we can bring it about. So the people on the panel, I'm very pleased to welcome. We have Samira Ben Omar, who has been a brilliant community activist, this amazing bridge really between the health sector and the community, and one of the founders of great initiatives and organizations, Community Voices and Community Champions. We have Clenton Farquharson, who is Assistant Director of a great organization called Think Local, Act Personal. And Clinton has many years of experience as a campaigner and a thinker and a doer in the space of trying to move the system and public services towards a do with approach. We have Katie Kelly, who was formerly Deputy Chief Executive at East Ayrshire Council. East Ayrshire Council completely rethought the way they worked to move towards an approach that really put working with and doing with communities at the heart of everything they do. And Katie is also the chair of New Local, an organisation that is driving forward community power and has been doing that for many years. Cormac Russell is also joining us. Cormac is the Managing Director of Nurture Development, but many of you may know Cormac as one of the key thinkers, along with John McKnight, behind asset-based community development, and has been working on that for many years, changing the system very effectively in many areas towards a do with approach. And we have Mark Spencer. Mark is a GP at the Mountview practice in Fleetwood in northwest England, but Mark has effectively been working with the community and many other people in Fleetwood to completely reinvent the way healthcare and wider public services are delivered in Fleetwood towards a much more do with way of working. And Mark, I would like to start with you, if that's all right. As I said, you've spent a decade or more trying to make change happen in Fleetwood towards a do with approach. So I wanted to ask you first, for you, what does do with mean as opposed to doing to?
Thank you, and thank you for the invitation. It's fantastic to be part of this launch, which I'm really excited about. And funnily enough, do with doesn't start with doing. I believe it starts with listening. I believe it starts with deeply listening to individuals. It starts with deeply listening to neighbourhoods and communities. And listening in order to understand. And there's one fundamental question that we keep coming back to, and that's what matters to you. And until we can develop a real joint sense of purpose with our residents, with our communities, and then all of us who are in the public purse and with the voluntary sector and the faith sector and so on. Only when we can really understand what matters to individuals and communities can we then start to think about, so how do we create a more hopeful future when a lot of our communities are feeling completely hopeless? And that takes time. And as you said at the very beginning, I've been listening to my community now for over 10 years, and yet people still come to me and say, Mark, what's going on in Fleetwood is brilliant, but it's taken you 10 years. How can we do this in 6 months? Well, you can't, because listening also builds trust, and we need to regain that trust across our communities, because it has been fractured. And then, given that it takes so much time, who are the anchors in those communities? We talk about anchor organizations. But it's anchor human beings that are so important to a community over periods of decades. So who are those anchors? And most importantly, the anchors are our residents, but the anchors are also people that are supporting that community in the long term. And that's why I think primary care healthcare professionals are in a good place, as are teachers, as are those local authority people who are vested in the community for decades. So do with, to me, is about listening, is about time, and is about human beings acting as anchors in those communities.
Thank you so much. I mean, a really clear explanation there of what do with is. And I think that shift from telling to listening, from feeling that you're in charge as the public sector or the state, and actually being the organization that follows where the community wants to go, where individuals and families want to go, is absolutely key. And Samira, could I come to you and just ask, from the community side, what does it mean for a community to have public sector institutions that actually are trying to do things with them and are trying to listen as a starting point, as Mark said, rather than the sort of predominant model we currently have now, which is overwhelmingly do to?
Okay, thank you so much for inviting me. And it's such a joy to be among such incredible people. And I wanted to echo exactly what Mark had said. The idea is you start with a conversation, you don't start with a plan or a strategy. But there are I think from my experience, there are some key principles. If we're going to really work and connect differently with our communities, it's about having a different type of conversations, but also having the conditions to do that. And for me, there's four things that really enable a shift, a paradigm shift in really thinking about how we work with communities. And those are One is just the starting point of actually communities do more when they decide for themselves. We've seen it time and again. There's enough evidence out there to really kind of shift us towards that. We don't need any more evidence. We just need to actually start acting on that. The second, community and faith spaces are the lifeblood of local action. We've seen it during COVID. We've seen how they mobilized. They weren't waiting for us to give them a plan or a strategy. I always say Gold Command started in the community, in neighborhoods, at grassroots, where people were knocking on the door and asking. They didn't wait for us. So they're not waiting for us to give them permission or to empower them. They're already empowered. They just kind of need us to get out of the way and let them do what they do so well. The third one is about actually kind of racism and its impact on our community. We've seen it during COVID. We've seen the disproportionate impact, and we have to acknowledge it and keep it at the forefront of our conversations. Can't really ignore it just because it's not on mainstream media. And the final one is about actually measuring what people value. So our institutions tend to measure in a very transactional, very a programmatic approach. Is how do we actually humanize what people value? How do we humanize the way we actually kind of connect differently with communities? And a very classic example is I always give, there's kind of the classic example of a Chad who's an amazing GP and one-man social movement who says, you know, kind of having your beard trimmed improves your clinical outcome. And the one recently that I kind of shared, actually kind of having your carpet fixed improves your A&E attendances, and just because somebody keeps falling through. So how do we to connect to the person and the way they live their lives, or do we connect to actually the kind of things that we can tick? So I think for me, those are kind of the really important, really critical principles that really kind of enable us to do that. To do that requires a different type of relationship, a different way, stepping outside of our boundaries, stepping outside of our organizational and institutional boundaries, and connecting differently with communities in the way they define themselves, not in the way institutions define themselves. I always answer when people say to me, how do you connect with communities? I always say, who's asking the question? Because as a commissioner, their view or their definition of community is very different from a provider, from a local authority. So communities are not how we define them. Communities define themselves in the way they connect to each other, to their networks and their neighborhoods.
Thank you so much, Samira. Cormac, let me come to you. I mean, I think Samira made a really important point there, is that we see lots of do with community-led, much more relational type working happening, you know, in many areas across the front line of public services. But everyone I've ever encountered who is driving forward that change says to me, it is so difficult to do this stuff. The system seems to get in the way and make my life difficult to generate the impact and change I want, even though we know it works. In your view, what are the blockages? Why is it so difficult to make that change?
Thanks, Adam. And this is great. It's lovely to be in a conversation like this. So, and couldn't come at a better time. So thanks for that, first of all, and for all you've done to convene this. The blocks, I suppose, primarily is institutions need people's needs. And so the starting point is often from the perspective of a one-up, one-down relationship. And that's as compromising for the practitioner that wants to work and build mutual alliance as it is for the people in communities that are put upon in that way. So the paradigm is problematic from the outset. So in a sense, we have to be willing to make good trouble. So there's a disruption that's required. And we know that when people lean into that as practitioners, all kinds of good things happen. But that's the first thing, to actually acknowledge that a lot of how we think about change and help needs to change. And so that's one key block. I think the other sometimes as well is that we've foregrounded this idea that, you know, my health is in the hands of a doctor. So there's a story, a narrative, a public narrative, which is as dominant, I think, often in the minds of individuals, the public, so to speak, as it is in the institutional culture. And I think we need a better public narrative. That's part of why these conversations are so critical. But I think within that, there's a recognition that the block is that we're foregrounding the role and the capability of institutions, often at the expense of the capacities and capabilities of communities. And we need both to be in an alignment with each other. So if we're foregrounding, if we're eclipsing, then that's a massive blocker. So thinking about that is really interesting, because often even when people think they're doing with, what they're actually doing from an institutional perspective is they're coming with what they think is, a good agenda. So they've got a version of salvation, and they say, now community, do this with us because we know what's good for you. And that's not doing with. So another, I think, dilemma or block, if you like, is that we haven't taken enough care to genuinely enable communities to figure out what matters to them, not only individually, but also collectively, and to act powerfully, not just as volunteers, but to act powerfully and consequentially and with a democratic mandate behind them. That's got to be the starting point. And without addressing that block from the beginning, I think we're going to be in real danger of hitting our targets and missing the point.
Yes. Thank you, Cormac. And I think that idea of trying to develop a very different narrative about how the state and public services work, not just for people in the public sector, but for people outside or the general population, if you like, is absolutely key. And for me, that's why I think the Do With movement has potential, because movements, if they get off the ground, can be really good at shifting discourse and changing narratives, I think. Clenton, you have spent years with this message. You've been communicating a Do With message, campaigning for it for many years. What, in your view, are the sort of key objections, the key things that have got in your way of really being able to drive that change through?
Thank you for the invite, firstly, and Think Local, that personal, really supports this Do With movement. And from my perspective, let's be honest, to pick up on some of the biggest resistance or blockers aren't about process for me. They're about emotion and about fear. Fear of losing control, fear of being exposed, and fear of not having all the answers. And the system is scared of what it cannot control. So it builds walls where it should be building bridges. It hides behind processes, but behind hierarchy, behind titles. And it talks about empowerment, but doesn't trust people with real power. We still hold on to this damaging myth that people on the receiving end of services can't possibly be trusted to shape them. And that's not just wrong, it's harmful. It's dehumanizing, and it keeps
Again, sorry, Clenton, you're just glitching a little bit there. Yeah, carry on now. Sorry, Clenton, you broke up a little bit, but do carry on. I know you can't. We can't. Sorry, Clenton, we can't hear you at the moment. Maybe just we'll come back to you in a second. Sorry, because you were in flow and it was amazing what you were saying, but unfortunately we've slightly lost sound. So we'll come back to you in a minute. Hopefully, maybe it's just your Wi-Fi's gone down a little bit. Katie, let me come to you, because you drove forward. You're part of a team driving forward real change in East Ayrshire. You've been working on this agenda of Do With for many years yourself. I wanted to get a sense from you of what do you think is in store for the system if this change isn't made? If we don't move towards Do With and we stick with the sort of do to top down, very institutionalized mentality and ways of working, where are things likely to end up?
Yeah, I think this is you leading me into your Armageddon narrative, Adam, that I've been reading a lot about recently. I think for me, the systems that we have are made up of people, or they're ecosystems. So that's the first thing to say. This is all about people. And I think, the system can sometimes be something we hide behind. And I think for me as well, the systems that we have just now, we're all acknowledging it. It's been acknowledged everywhere that they are no longer fit for purpose. Many of them are not. They were designed at a different time with goodwill in mind for that society at that time, post-Beveridge. We've got a lot of baggage in this space. And the baggage is really that evolution of how public services have taken place and evolved over the years, has left behind some baggage originally around people being passive recipients who sat back and waited to be tended to, or people who are customers, or clients or service users. So these labels then actually dehumanise people and made a bigger kind of schism between the people they serve and the state. And I think we all know if we go down this route, it's no longer affordable. So if you're looking at it from a fiscal point of view, that's one thing. But actually, I don't think that's the main thing. I think it's what Clenton said there. Working in this way can cause harm because people don't have enough resource. They're not, this 10 minutes of care in a house. It's just not what our society should be. It should be about kindness and love. And to me, that we've overcomplicated this. This is about people's hopes and dreams, including ours, whether we're in a system or not. And whether we're in a system or not, we're part of a community. And I think we have all skills and talents to bring to bear. And it's about how we work alongside each other to share those skills and talents. And I think they're very human words that have already been mentioned, like trust, about building relationships over time so that really, good things can take place. And it's not about being transactional where I do something to you and, I can record you as a number or an amount of time. This is about my interaction with you will cause something to happen and your interaction, and for me as well as you. And so there's something about that reciprocal thing that we have to consider. So I think we do know that the systems that we have and public service that we have, although very well-meaning, is full of incredible people wanting to work in this way. But the baggage and the way that they were constructed around hierarchy, around permission cultures, does generate things like fear. And I think the other big thing to note is that communities don't have departments. So people's conversations are often funneled into where they're coming from to try and fix people. People want to fix each other out of kindness and out of love, but actually fixing isn't sustainable. It's not long term. So much more this is about relational, and the way I've seen it over many years now, and it took 10 plus years for this to really bed in across a whole organisation where bin men were part of this, housing officers and others. It was absolutely groundbreaking for people. People want to work in this way. They want to be able to say yes. And basically all of us want is to have the happiest, healthiest life possible. And we need to be in each other's space to see a way to do that. And a final thing sometimes we shouldn't do with, I think it was said by, I don't know if it was Samira, but sometimes we need to get out of the way and actually let people do things for themselves. And horizontal connections and natural community connections will outlast all of the professionals every time.
Thank you so much, Katie. Clenton, I'm going to come back to you, and I'm hoping that we can hear you now because you got cut off halfway through. But let me ask you, let's move the conversation on a bit. How do we start breaking down that resistance? We know there is enormous resistance in the system. It's a very do-to system. It's not a do-with system. So how do we start breaking down those blockages in your view?
We have to remember keeping us from the future we all want, and the greatest barrier is co-production. And for me, it isn't about capability, it's like institutions' egos. And what I mean by stuck.
Sorry, Clenton, you're breaking up. Sorry, Clenton, you're breaking up again. I'm really sorry about this. Maybe I don't know if you stay forward, maybe it's your mic. I think it's when you move backwards, maybe it starts glitching. Yeah, that's better. Yeah, that's better. I think just stay forward. Yeah.
Okay, sorry about that.
That's all right.
What I was saying is, if we can have the courage to lead with curiosity, not control, with openness and not ownership, and with the faith that people are experts in their own lives, this would be a way of breaking that barriers and seeing that people want to belong and use their mutual exchange, reciprocity, and place and time, and we want to use those skills, but it's about seeing us as people who can control our own lives, not as passive recipients. And that's quite hard when you think about the fixed mindset around how people see people either as service users, as passive recipients, not people who have their own agency and want to create the conditions that help us live our gloriously ordinary lives.
Thank you, Clenton. Cormac, I'd like to get your thoughts on this. I mean, you've always been an enthusiast for grassroots organising, for movements, for them as building change, and in many ways, asset-based community development is all about creating sort of micro movements, if you like, for change. But when you're thinking about shifting a whole system and breaking down the resistance across a whole public and governmental system, where do you start? How do we start doing that, do you think?
Well, it's like the old joke, when somebody looks for directions, the answer is I wouldn't start from here. But we are where we are. I think there's lots of really promising practice already happening. And it seems to me that in every instance, it's community and citizen centered. It's got some focus on strengths and assets from the community perspective. It's often place-based. It's always relationship oriented, and it has a deep commitment to inclusion. So I think things like recognizing that the neighborhood, is a primary unit of change. It's not the only one, but it's a really powerful one, because that's where a lot of different folks can get out of their silos professionally and actually have a common orientation towards place. That's helpful, but even more helpful, it's a place or a scale within which individuals and associations in community can actually come together and make power. You see, I think the issue often is that we've created an inversion of democracy where the role of citizens is being defined as that which happens after the important work of professionals is done. And actually in a democracy, it's meant to be the other way around, that the role of the professional is defined as that which happens after the important work of community is organized and done. And so, in a sense, this community first principle is a really key foundation stone to doing with, because effectively we can't really build a do with movement unless communities are treated as fundamentally sovereign. But they can't be sovereign if they can't organize, if they can't be animated, if they can't be built. Now, of course, you can build community around affinity and around issue, and we should, but we can also do it around place. So thinking about the neighborhood as a unit of change is really powerful. It's an interesting movement in the States at the moment, which is looking at the idea of every neighborhood organizing to have its own primary care. I think it's a really, really interesting idea. It totally flips on its head the question, how do we get better institutions? How do we get better services? To know, how do we organize our communities at the neighborhood scale and then figure out how our services can supplement that power? That's a much more fundamental and radical shift, but it's actually, ironically, much more achievable as well.
So interesting. So, I mean, in many ways, what you're saying is that one of the focus of this movement is really having a conversation about scale and how we operate and where we put our efforts as a public sector and how we build those relationships. I mean, Mark, you have been operating at that scale. I mean, it's a town rather than neighbourhood, but you're working neighbourhoods as well. Fleetwood is a town of what, about 28,000, something like that. I mean, how important for you has that sort of focus on place and on scale been to being able to shift to a do-with way of working? And how difficult has it been to persuade other parts of the public sector to think at that level?
Size really does matter. And we were a primary care home, part of National Association of Primary Care, and the size seemed to be somewhere around about 30,000 residents in a specific geography, so a small town or a neighbourhood within a city where people could identify, this is where I live, this is my community. This is my home. This is what I care about. And there are enough healthcare professionals within a community of that size, probably about 100, 120 across general practice, community pharmacy, community nursing, mental health services. There are enough schools. It gives you the faith sector. There are enough people with energy to connect together, to coalesce around a sense of purpose for that community, with the residents at the heart of the community. Because all of this is relationship based. It's not contractually based. The system cannot contract for integrated care across multiple providers when a lot of those providers are charities, a lot of those providers are schools and churches, and the most important people that doing the provision are the residents themselves. And that's something that cannot be contracted for. So this is relationship based integrated care, coalescing around a theme that the community itself decides. So our most important issue at the moment as a community, it isn't what our ICB told us was our most important issue. Our ICB told us it was our respiratory admissions to hospital. Our residents said it's the emotional health and well-being of our children. It's our children's mental health. That is the most important issue to us at the moment. And that, how do you improve children's emotional well-being? The NHS can't do that. It could only communities and families working with those of us in healthcare, with those of us in schools, with those of us in local authorities, all of us working together. And we think we're really clever. We think we have the solutions because, we are professionals and we've got degrees, but we don't. When we listen to our residents had the solutions, and enabling, empowering, supporting, working with our residents to put those solutions in place, not only improves individual self-confidence, improves people's individual emotional well-being and mental health, but you then start looking at the wider determinants of health, such as education, such as getting into jobs and employment. All of those things improve. And that's how we create healthier communities, by giving up control and letting our residents get on with it and supporting them to get on with it.
Thank you so much. And yeah, I mean, the work you're doing in Fleetwood is just amazing. I've been lucky enough to go up and see what you're doing a couple of times, and it just shows how transformational just that shift in mindset towards that humble do with way of working, getting out of that public sector way of thinking, and that governmental way of thinking can be totally transformational in all sorts of ways. Samira, I think one of the really important things about this do with movement is that it can't just be a movement of people working in the public sector. It needs itself to genuinely be a do with alliance between people who are fed up in the public sector and want change, of which there are many, but also I think people outside the public sector, in communities, individuals, families who engage with the public sector a lot, who are also tired of having things done to them and want to be heard and want things to be done in ways that they know are genuinely impactful and respect them. So in your view, can we create that alliance? Do you think there are communities and people out there ready to ally themselves with people in the public sector who want change? And can this be a genuine force across society and across the public sector for a genuine shift in that way?
Absolutely. I think there is something about the communities, and I genuinely believe that change is going to come from our communities and from our frontline staff. And there is something about blurring the boundaries between and liberating our frontline staff to do what they know they need to do at neighborhood level, at community level. They know they're connected, and especially they are of those communities. So the idea is, how do we leverage that? How do we work and connect to that? The second is, and I think I probably mentioned this to you before, this is about actually kind of not policy people talking to policy people. This is really about connecting to the agenda and the way people live their life, and that it's complex, it's messy. It's about actually kind of really sitting with that messiness and sitting with those issues and those anxieties. I mean, are communities ready? I would say absolutely some communities are ready. My personal experience working with the community champions was phenomenal in terms of one, mobilizing and working with frontline staff and with local systems. I mean, it was just about creating the space where you support people, you enable, you develop the capacity of people to actually kind of do things for themselves. It started small as a health champion. They said, oh no, we're not health champions, we're community champions. Okay, you're community champion, what do you want to do? Oh, there's a real issue around maternity. We want to set up maternity champions, peer champions. Now you've got neighborhoods setting up climate action champions, phenomenal community leaders who actually kind of said, I want to do this, and I want to do this in a way that it actually connects to my community. So climate action might feel a little bit kind of waffly, and it's kind of just a big agenda. But a local neighborhood, when you have somebody who's of that community saying, these are the things that we need to do because it improves my life and it improves my community's life, therefore we want to do it. So I think communities are ready. The change is going to come from our communities and through the frontline stuff. Was phenomenal. We just did a workshop with about 150 people of frontline staff. These are nurses, healthcare assistants, GPs, and with community, local volunteers, and also kind of people from the local community. It was phenomenal. You could mirror the issues and challenges of frontline staff with those of community, navigating the system, accessing, connecting. So I think there's an opportunity to really liberate the frontline staff to enable them to actually kind of work closely with communities.
Absolutely. And I think actually my experience, I'm sure everyone's experience here, is that, you know, once actually frontline staff are freed up to work in this do with way, it's transformational for them as well. Huge increases in job satisfaction, in morale. And the phrase that I keep hearing from people who have made the shift is, this is what I came into public service to do, to work in this way, not just process people as quickly as possible. So now, absolutely agree with that. Okay, so I have one final question for each member of the panel before we move to the breakouts. So my question is, I'm going to start with you, Katie. Where do you think this Do With movement should be focusing its efforts? What should it be doing to start genuinely breaking down resistance and shifting the whole system towards a Do With way of working?
Yeah, I think it's a great question. I think we really want this to take off, and movements are about connections and about people feeling invested in them and that they'll make a difference. So I think we talked earlier on about a new narrative, but we need to bring what we mean by do with to life for people, to share stories. And those stories aren't public sector workers, but they could be on a screen telling what it felt like, but maybe conversations to show that actually we mean that this is an equalisation of power. So conversations of change with people who serve and people who are served, people living together in communities, I think is going to be a massive way to take this kind of work forward, and really for people to get in back of it. Also, I think it'd be great to get people talking, and I know that you've started this today and you've got a whole other range of things, but conversations where we hear people's different points of view, that we change our own opinions through conversation and discourse and discussion. And by disagreeing respectfully, we start to change our culture, and the narrative changes in a kind of more by osmosis. So I think that's important. And I just think one other thing to say, so many things have resonated with me today in the work that I led with bin men and grave diggers and housing officers, putting their job descriptions second and their ability to serve first, and them having love of place. And actually about, most people working in local public sector, 70, 80, 90% of them work and live locally. So they are the community. And so there's something about changing that dynamic and taking away the kind of role that they have as secondary. They might have skills and talents, but their first thing is to serve and have a wider conversation about hopes and dreams. And I think this is a very human movement. And I think the last thing, for me, it's less about scale and more about spread. And that's what a movement can do. It can spread interest. And some of the work I'm collaborating with Cormac and Brendan Martin on it is around how we might help workforces to change through a kind of concept we're developing called asset-based workforce development that runs in parallel with asset-based community development. Because asset-based community development, Cormac and I know both can hit the system and bounce back off it. And we think if it runs in parallel, we can help people to become enlightened and freed up, as Samira said, to allow whole bodies of people, not community workers, but bin men and directors, to be able to have the skill set to be alongside and be with. So that is a very exciting thing for us, because that would be big spread. And this campaign would certainly help people to be talking about that kind of work and maybe ease the situation and make the conditions right for that to change in a big way.
Brilliant. Thank you very much. Clenton, your thoughts. Where should Do With be focusing its efforts to generate real system shift?
It's the start with the Tories.
Yeah, we can't. Sorry, Clenton. We can't. Sorry, Clenton. We can't hear you again. It's breaking up. Really sorry. I'll come back to you in a minute. Maybe it's just. I think it's just your mic. I'm sorry about that. Samira, let's go to you. What do you think Do With needs to focus on to really drive that change?
So I think as a social movement, we need to hone in on people's frustration. And I think frustration is a great motivator to really kind of push people forward. And we mustn't forget that. And we mustn't forget that we are here because we are frustrated that actually, despite all the investment, despite all the policies, despite all the plans, things have not, our health inequalities are widening. People are actually living in worse environments, and actually people are disconnected. So I think for me, what we need to actually kind of do is generate enough conversations and tap into the frustrations in the system. We've all had enough conversations with chief execs, with directors, with leaders, and in community with followers who actually kind of really hone into this. So I think for me, it's to hone into the emotion of frustration and actually can use it as a motivator to generate a shared purpose and a shared way of actually kind of moving this forward.
Thank you, Samira. Mark, your thoughts?
Thank you, and I won't repeat everything I've heard. I agree with everything that's been said so far. So I'll say yes and advocacy, yes and influencing, yes and the evidence base and the research. That there are. That's what tends to change people's attitudes and minds who are in those positions of power, to encourage them to give up the power. So collecting evidence and most powerfully people's stories, human stories, resident stories. Let's collect as many stories as we have and go, this is us. This is us.
Thank you. Clenton, I'm going to give you one more go because I want to hear what you've got to say. Give it a go. Still on mute. Go for it.
I hope you can hear me. I don't know what's going on.
Yeah, that's good.
For me, the change, like I said, it starts with where the power is. We have to look where the power is and start upstream, not after the decision is made, to make people feel that they belong, that they matter, their stories matter, and also before the agenda is set, and when the questions are still open, and also challenge who sets the table and who gets a seat at that table. If you're not shaping the system, it's shaping you, and we need to redirect resources to where they can grow equity, not just chase efficiency, and build coalitions, not in the boardroom alone, but in communities, CAFs, church halls, faith groups, my football club, in places where people already gather. It needs to root itself in the lived wisdom of people and fueled with the solidarity, not charity, and change the narrative from we deliver services to we shape futures together. And we are not beneficiaries, we're architects of our future. And we need to stop asking what's wrong with people and start asking what's strong with them, that Cormac Russell often talked about. But my hope is, it isn't a wish, it's that we work at it together and we all have a role to play in co-creating just the joyful tomorrow that we need to start looking for. And the future isn't something to inherit, it's something to build together for me.
Well, I'm very glad your mic worked there, Clenton, because that was inspiring. Let's help people be architects of their future. What a great phrase. A number of great insights and phrases there. Cormac, final thoughts from you on where Do With should be putting its efforts in.
Thanks, Adam. Again, I agree with everybody's wisdom there. And I think there is something about just acknowledging that if the authority is with the institution, then that authority needs to be relocated to associational life. It won't happen by accident. So, how do we catch ourselves doing that? Well, I think one of the things is to acknowledge that there are lots and lots of people on the front line who, by instinct and by virtue of the fact they're in neighbourhoods, really understand the communities that they serve and are doing this already. So as people have already said, let's lift up those stories. Let's valorise the promising practice. But I think also in terms of incentivising and maybe taking some of the fear away, it might be really useful to start thinking about how we use existing legislation. So I'm thinking of the Social Value Act. Well, let's lean into that. And in the same way that we make developers prove that they're not going to do harm to the environment they're developing in, let's start holding institutions to account with respect to whether they're doing harm in the way that they're intervening. I think in all kinds of ways, if we could actually push back against institutional overreach and institutional assumptions, it would create space for community first, but it would also create space for practitioners. I sometimes joke that inside every public servant is a citizen waiting to be liberated. Let's liberate them. I mean, if you go into any organization, for profit or not for profit, and you ask three simple questions: what are you doing that you like doing? What are you doing that you dislike doing? And what dumb rules are you expected to follow every day? The answers are there. It's not complex. There are plenty of people, there are social workers listening right now who are, by virtue of the system and by dint of the system, taking children off of families instead of finding kinship circles and supports. It doesn't take a genius to redirect and redefine that, but it will take some practical work, incentivizing community-based solutions and community alternatives in the practitioner is key. And I don't think that's hard to do. So that's one of the reasons why myself and Katie are actually working with Brendan to say, how do we get alongside those practitioners who often are telling us they don't even get to play to their own strengths? And if it isn't true within their organization and within their practice, it's probably not going to be true with respect to how they work at the community. So that final piece is, let's turn down the rhetoric and the narrative, and let's really look at the practice. What is the practice? When we talk about #DoWith, what does that practice actually look like? And really featuring that in story, in narrative, and in pedagogy. That's the way forward, I think.
Well, thank you very much, Cormac. And yeah, that idea of liberation. Let's liberate people working in the public sector who I think many feel very, very constrained at the moment. But let's also liberate the people, the communities, the individuals, the families that are out there who also want to be treated with respect, be listened to, and would like to work in a collaborative way to deliver change. Well, thank you so much to all of you. That was incredibly insightful and a really great way to kick off this event and also the Do With movement. I think if we were in person, you'd be getting rapturous applause now, but that was absolutely fantastic. Okay, to everyone else on the call, this is the tricky moment.